Have you ever wondered what diabetes mellitus really is and how it affects our body? Well, it's a chronic health condition that happens when our body either doesn't produce enough insulin or can't use it effectively. Insulin, as you may know, is a hormone that our body needs to convert the food we eat into energy. Without enough of it, or without the ability to use it right, our blood sugar levels can rise, leading to a myriad of health issues. It's not a minor problem either. Diabetes mellitus is a global health issue affecting millions and millions of people all around the world, with numbers rising every year. It's more than just a personal health concern, it's a worldwide epidemic. So it's crucial for us to understand it, to combat it effectively. Now that we know what diabetes mellitus is, let's delve deeper into how it works. So, how does diabetes mellitus actually mess with our body's functions? Let's break it down. Under normal circumstances, our body is a well-oiled machine. When we eat, our body breaks down food into glucose. This glucose is our body's main source of fuel, like petrol for a car. Insulin, a hormone produced by the pancreas, acts as a key, unlocking cells to let glucose in, converting it into energy. But with diabetes mellitus, there's a wrench in the works. The pancreas either doesn't make enough insulin, or our body can't use the insulin it does make effectively. This is like having a key, but not being able to turn the lock. As a result, glucose can't get into the cells and stays in the blood, causing high blood sugar levels. That's the mechanism of diabetes mellitus in a nutshell. But did you know there are different types of this disease? Yes, diabetes mellitus isn't just one condition, but a group of them. Curious to know more? Let's dive right in. The first type is type 1 diabetes, a condition where the body doesn't produce insulin. Insulin, as you know, is a hormone that helps regulate blood sugar levels. Without it, the body struggles to keep these levels in check. The second type, type 2 diabetes, is quite different. Here, the body does produce insulin, but doesn't use it effectively. Hence, blood sugar levels can rise, leading to various health complications. Lastly, there's gestational diabetes, which is exclusive to pregnant people. This type generally resolves after giving birth, but it does increase the risk of developing type 2 diabetes later in life. Each type of diabetes mellitus is unique, with its own causes, symptoms, and treatment strategies. Understanding the types of diabetes mellitus is the first step towards prevention and control. Speaking of which, can diabetes mellitus be prevented? The answer is, in many cases, yes. Let's dive into how we can protect ourselves from this condition. It all starts with lifestyle changes. Maintaining a healthy weight is the first step. Excess weight, particularly around the waist, increases the risk of diabetes. Regular physical activity is another key. It helps control weight, uses up glucose as energy, and makes cells more sensitive to insulin. The third pillar is a balanced diet. Incorporate fruits, vegetables, whole grains, lean proteins, and healthy fats into your meals. Try to limit intake of processed foods and beverages high in sugar. Lastly, don't underestimate the power of regular checkups. Early detection can lead to better management and slower progression of the disease. Remember, these measures not only prevent diabetes, but also contribute to overall health. Prevention is always better than cure. But what if one already has diabetes mellitus? Managing diabetes mellitus may sound daunting, but with the right treatment and control measures, it can be kept in check. Let's delve into how this can be achieved. Firstly, insulin therapy is a common form of treatment, especially for those with type 1 diabetes. The body needs insulin to allow glucose to enter cells, and in some cases, the body can't make enough or any at all. That's where insulin therapy comes in. This may involve injecting insulin under the skin or using an insulin pump. Next, we have oral medications, which are typically used in cases of type 2 diabetes. Some of these drugs stimulate your pancreas to produce and release more insulin. Others inhibit the production and release of glucose from your liver, which means you need less insulin to transport sugar into your cells. But treatment isn't just about medication. Lifestyle changes are crucial. This includes maintaining a healthy diet, full of fruits, vegetables, and whole grains. Regular physical activity is also key. Aim for at least 30 minutes of moderate intensity exercise, like brisk walking, 5 days a week. Regular glucose monitoring is yet another important aspect of controlling diabetes. This helps to assess how well the treatment plan is working and if any adjustments need to be made. Adherence to treatment plans is also vital. This involves taking medications as prescribed, following dietary recommendations, and maintaining a regular exercise regimen. Healthcare professionals play a key role in managing diabetes. They guide patients through their treatment plans, helping to adjust them when necessary and providing support along the way. Remember, managing diabetes isn't about perfection, but about improvement. Small, consistent changes can lead to big results over time. Remember, diabetes mellitus isn't a death sentence. With proper knowledge, prevention, and treatment, it's a condition that can be managed effectively.